Today I'm going to be teaching you guys about IV push station and the things that you have to know in order to be successful in clinical. So there's really 5 things that you have to know when you're looking at medications to give when you're giving IV push medications. And those 5 things that you need to know, I'll go over each one specifically for you guys. So the first thing that you do need to know when you're looking up your medications is you need to know, of course, the name of the drug. What is the medication? And you must know and always know the brand name and the generic name, because when you're providing the care to the client's never going to know the generic name. They're not going to know what furosemide is. They're only going to know that that's their water pill or it's their Lasix and stuff like that. So when you are looking at medications, you need to know both brand and generic. When you go into the Pyxis system, the reason why you need to know the generic name is because when you pull medications from your Pyxis, that's the way that the medication is going to be provided, is by the generic name. So it's always best to know both of them when you're providing care to the client and then also when you're pulling the medications to give to the patient. So that's the first thing you'll need to know. The second thing you need to know is what is that medication actually for? So you can give different medications to different patients. It just depends on what it is, right? So if you're giving Lasix to a patient, there's tons and tons of reasons why we give Lasix to patients. Some of it's because they have pulmonary edema, because they have CHF. Other patients maybe have renal failure and they have overload or just edema, and we're helping to pull off regular fluid. Sometimes we'll use Lasix for hypertension. So there's all different types of reasons in which we give medications to our patient. So it's up to you guys to know what is it for, specifically for your patient. That's the key to why you need to give medications. Other thing that you need to know is the major side effects of the drug. So when I'm talking about major side effects, I don't want every single side effect in the book. I mean, when you look at a side effects topic in your med book, which your IV drug med book, it'll give you like a million side effects. And the reason for this is because when they do a drug research, they have to get every single side effect that every patient's had as they were getting the drug. What that means really is that if that patient had nausea, and it was only one patient out of all 5,000 that got it, if only one patient had it, they still have to say that there's nausea as a side effect. Doesn't mean that everybody's going to have it, it's just a side effect. So my way around that and to get your heads to stop thinking about all of the side effects is just to simply think about the classification of the drug. So let's think about 2 different ones. The first one I'm going to talk about is furosemide. And in your IV drug book, it has like a blue box, all right? This blue box is super, super important as it relates to the major side effects. So if I look in this, the classification of the drug is it's a loop diuretic. Well, that really doesn't tell me anything, really, because loop diuretic for just the common person, we have no clue what that means. So it's up to us to understand what a loop diuretic does. And the most important things that I have to know is this. What does the loop diuretic do? Does it hold on to potassium or does it waste potassium? That's my job to understand. And that's one of the major side effects. Also, with it being a diuretic, I know it's going to pull off tons and tons of fluid. So if it pulls off lots and lots of fluid, that makes our volumes to go down. And if we don't have enough volume in our body, then our blood pressure reacts in a certain way. And when our blood pressure reacts to a diuretic, it will go down. So major side effects, think about it. It's a loop diuretic. I know loop diuretics waste potassium. So major side effect, it's going to cause potassium levels to go down. I know a diuretic pulls off fluid, which is going to make my volumes to go down, which is going to make my blood pressure go down. So I know for this drug, the major side effects are going to be watching their potassium and then looking at their blood pressure. So big 2 assessments that I have to do prior to giving the drug to my patient. Because if I don't look at those assessments, then I can cause major, major harm to my client. So that's what we need to know when we're talking about major side effects of the patient. Now, there's another one I kind of want to talk about, and that one is morphine sulfate. So morphine sulfate, if you look at this one, it has all different types of classifications. And when I talk about classifications on this one, it's an opioid. So when I think about opioids, what do those do? How is my patient going to present when I give it to them? Well, opioids make everything kind of go to sleep, right? So if I start from my head to my toe If I'm going to sleep, my LOC is going to be, they're going to be drowsy. My lungs, if it's putting them to sleep, we're going to breathe slower. So respiratory depression. My heart, it's going to make my heart relax. So my heart's going to get, the pulse will go lower and my blood pressure will go lower. Think about gut. It's also going to slow down the GI tract. It makes everything go to sleep. So when I'm thinking about major side effects, think about that. LOC, respiratory depression, lower blood pressure, GI tract stimulation decreases, okay? But then, what are my major side effects? So if I was going to give this to this patient, what would I have to assess in order to not cause harm to my patient? Well, if their LOC is a little low, would that cause me to not give them that medication? Well, no, it's okay. But if they're unresponsive, then yeah, we have an issue. If their respiratory rate's at 12, can I give it? That's up to you to find out. If their heart rate or their pulse is their pulse or their blood pressure is too low, when would I not give it? It's up to you guys to understand that information. Now, GI tract. If their GI tract is slow, would I hold that medication? No. I just have to provide other types of interventions so that I can help speed up their GI tract because it's not one of the major side effects. Also, we can use morphine as a pulmonary edema adjunct. So when patients have pulmonary edema or difficulty breathing, much like our hospice patients or patients near the end of life, we give this drug to them to help them breathe easier. You have to know what it's for, specifically for your patient. Now, the last two things you've got to know when you're giving IV push medications. This is just specific to IV push medications. The first three, really, guys, are for all medications. You have to know that. But for IV push medications, you have to know dilution and the rate of administration. And then this is where you'll find those specific things. So as we keep talking about the morphine sulfate, when you go into your book, you're going to look under the header, dilution. This is the header that you would find, and that's where you'll find the information for this. So as I look at this medication, it says morphine's available in different types of concentrations. We can do it IV push, we can do it as a piggyback, we can do it as a morphine, as a PCA morphine pump. It just depends on the way it's provided. But let's specifically talk about IV push, like I was going to go in and give an IV push to the patient. So I would look at the dilution to see if I needed to give it a certain way. Now, this is where this book gets kind of tricky, okay? So for the dilution, it has IV injection or infusion. Which one do I give if I'm given an IV push? I like to specifically talk about this because people think injection is an injection, like a sub-Q injection or an IM injection. In this case, it's not. That means if I have an IV infusion, I'm going to be giving it as a infusion, like a piggyback. But if it's an IV injection, that's an IV push. And that's the one that you have to look up, all right? So for this drug, it says each 0.1 to 1 milligram is diluted into 1 milliliters of normal saline. All right, sounds pretty good, all right? But that's for the infusion, and I'm not looking for that. What I need to look at is for that IV injection because it's an IV push. Here it says may be given undiluted. Uh-oh. This is where like your nursing comes into play. Your actual critical thinking comes into play. I know the book's black and white, but nursing is lots and lots of gray areas. So think about it this way. If you have a patient, 25 years old, he's having some pain, he's alert, he's oriented, no issues with blood pressure, he's walking around, and he just needs pain medicine, do I have to give it diluted? Probably not, right? But what if you have this patient? She's 85 years old, lethargic, unable to get out of bed, her blood pressure's a little low, and she's has a respiratory rate of about 12. Would you want to dilute that? I probably would. What dilution does for you guys is this, okay? It helps you it helps you to decrease the potency of the drug. If I dilute it, it's not as potent. It won't have as many harsh and major side effects, all right? So when you are asked by your clinical faculty, well, I don't know what to say. The book says this, and I'm da-da-da. You always speak to the book first. So when I ask you, what's the dilution for this drug? You say it may be given undiluted, but you know what? the patient in that room, they're presenting like this, so I want to give it like this. We want to see your critical thinking. Now, the last thing we're going to look at is the rate. And the rate means rate of administration. If you turn to the part of the book that says rate of administration, that is where you will find that answer. Once again, this one's all over the place. It says a single dose over 4 to 5 minutes. And you're like, what do I do with this one? It depends on your patient once again. The healthy one can go over 4. The unhealthy one, give it over a little bit longer period of time. It's up to you to make sure when you give that medication, you give it at the prescribed rate. So when you're asked by your clinical faculty, they want to know the answer from this book, and then they want to see what your critical thinking is. So that's what you really need to know, and the things you need to know for your IV drug medications when you give IV push medications. And so you're going to have to be able to look these things up so that you can give and provide safe care to your clients when you're providing IV care.